front of the Supreme Court, and I don't intend to do that.
Question number 4, Shane Ardern.
Thank you, Mr Speaker. My question is to the Minister of Health. What reports has he received on this quarter's national health targets?
Honourable Tony Ryall.
Mr Speaker, the latest quarterly report released today shows that district health boards have achieved 4 of the national health targets this quarter and made improvements in the other 2. The results show that 95% of hospitalised patients who smoke were offered support to quit in the last quarter of last year, which means we've achieved this national health target for the first time. And our district health boards have performed nearly 4,000 more operations than planned, and once again we're well on the way to exceeding the target of increasing elective surgery volumes for New Zealanders by at least 4,000 discharges a year.
Supplementary question, Shane Ardern.
What other progress can he report on the government's national health targets?
Honourable Tony Ryall.
There's been an increase to 93% of patients admitted, discharged or treated in emergency departments within 6 hours, which is an improvement compared to the last quarter and the same time last year. The national immunisation coverage of 8-month-olds increased by 2%, and the rates for Māori and Pacific increased by 5% and 3% respectively. The government is committed to protecting and growing the New Zealand Public Health Service, and we are seeing more high-priority frontline services being delivered as a result of the government's $14.1 billion investment in health this year.
Honourable Annette King.
Mr Speaker, will he give a guarantee that no DHB is manipulating his 6-hour target for patients being admitted, discharged or transferred from an emergency department, for example, by putting patients into other units so the clock does not start when the patient actually arrives at the emergency department?
Surely not.
Honourable Tony Ryall.
Mr Speaker, look, if you put that bluster aside, what I would be very clear to that member...
Point of order, Honourable Annette King.
Mr Speaker, it was a very straight question with no bluster, and that's no way to start an answer.
I agree. If the Minister could address a very clear question that's been asked, I'd be grateful. Honourable Tony Ryall.
Mr Speaker, I'm regularly assured that district health boards know that the government's very clear message to them is that we don't expect anyone to game the target. But I can tell that member I'm surprised she asks a question on emergency departments when she was Minister of Health. Huge numbers of New Zealanders languished.
Point of order, Honourable Annette King.
Apart from the fact it was a straight question to the Minister on his performance, he did not answer whether he would give a guarantee.
It was a straight question.
I am ruling that the Minister adequately addressed the question. Does the member have further supplementaries? Then we move to question number 5, Honourable Clayton Cosgrove.
Mr Speaker, my question is to the Minister.